Republican budget just unveiled yesterday, and today Paul Ryan is going to try and pass his first test in the House Budget Committee, get that plan on its way to the floor of the House of Representatives. First of all, thank you for the time.
Good to be with you.
You are either the bravest man in Washington right now or the man who wants to do in the poor and the elderly with your changes to Medicare and Medicaid. Which is it?
You know, see, this is the thing. Whenever you put bold reforms to try and fix budget problems, the other party uses it as a political weapon against you, and that is what has always dissuaded people from actually fixing problems around here. We can't be deterred from all of this hyperventilating rhetoric and all of this demagoguery. We are saving Medicare. We are saving Medicaid. These programs are going insolvent. They're going bankrupt, and they're driving the country into bankruptcy. And we're doing it now in a smart and gradual way by protecting people in and near retirement. 55 and above, no changes. We're fixing these programs for people in the next generation like me who won't have these programs if we stay on the path we are on, and we're paying off our national debt. This debt is getting out of control. Look around the world. We have sovereign debt crises all over the place. We see it coming here in America, and we don't want to have to do immediate surgery to the budget in a debt crisis. We want to preempt a debt crisis, and that's why we're going after the key things, the drivers of our debt, reforming them in a smart, gradual way, and we want to have pro-growth tax reform to get this economy growing again. We want to lift this burden of debt. We want to save these health and retirement security programs. We want to grow the economy, and that's what this plan does.
Even those who credit you for offering bold ideas, controversial ideas, and for at least starting this conversation, they do raise questions about your approach here. Let me read the Deficit Commission, Erskine Bowles and Alan Simpson, what they say. You served on the Deficit Commission with them. While we are encouraged that Chairman Ryan has come forward with a serious plan, we are concerned that it falls short of the balanced, comprehensive approach needed to achieve the broad bipartisan agreement necessary to enact a responsible plan. You don't have any revenue raisers in here, no tax increases, and you don't touch defense spending.
We do. We cut defense by $78 billion.
Well, that's what the president has already proposed.
But we take his cuts. We accept his cuts, which haven't occurred yet, and we accept the president's cuts. We actually agreed with the president on this point.
Well, what about the notion that this is not politically feasible here in Washington? The plan you've put on the table, maybe it'll satisfy House Republicans. There's no way it's going to pass the Senate. And even as a starting point for conversation.
That's right. So the Senate may not even pass a budget, we're being told. So I don't even know where negotiations start on that. The other point I would simply say is the commission, those guys are great guys, but we have a difference of opinion. If you don't address health care, you don't fix the budget. The commission didn't address health care. The big drivers of our debt are Medicaid and Medicare. It's demographics, it's healthcare inflation. You can't ignore those issues if you want to be serious about tackling our debt. And the other problem I would simply say is this. The problem in America is not that Americans don't pay enough taxes. The problem we have is that we spend too much money. Taxes are going back to the relative area where they've been as a historical percent of GDP. Spending is on a tear. Spending is projected to double and triple over this century. Spending is the root cause of our problem. We had to address spending. And so if we take our eye on the ball, the cause of our debt crisis, spending, and go over to revenues, we slow down our economy and we don't fix the problem. So what we want to achieve is fixing the problem, spending, and we want to reform this tax code to get economic growth.
Let's talk about your Medicare and Medicaid changes. Can you look Americans in the eye, those who are set to receive Medicare in the future, those 55 perhaps right now, or 54, about to turn 55, that they're going to get the same level of care, the same coverage that the current Medicare beneficiaries are getting?
People who are in near retirement get the exact same kind of Medicare they get right now. People 54 and below will get what I get. Paul Ryan, as a member of Congress, we will convert it to a system that is identical to the plan members of Congress and federal employees have. It works very well. This is modeled along the plan that Alice Rivlin and I introduced in the Fiscal Commission. The Medicare and Medicaid reforms that I'm putting in this budget are off the model that I've put out there with other Democrats in the past. So these reforms have had bipartisan support in the past. John Breaux, a Democrat from Louisiana in the Senate, was the guy who actually introduced this idea here in Washington a number of years ago.
The chairman of the Finance Committee, already going after you. He says what you're doing here, this is a transfer of wealth to the private insurance industry. You're having these Americans pick private insurance plans, and there are other critics who are already pointing out, listen, Paul Ryan's gotten more contributions from the insurers
they always
than anybody. $672,000.
I have no idea what those are. Look, if that's the issue, and if you want Medicare to be a government monopoly, and then you're going to have to be for rationing health care. We are not for government rationing of health care. I would simply say this to Max Baucus. Medicare already has private plans. The prescription drug benefit is private plans. We are modeling this reform after the prescription drug benefit. Name me another government program that came in 40% below cost projections. Nothing else did. The prescription drug benefit did. Why? because it has choice and competition. We don't want one Medicare monopoly provider. We want a bunch of providers competing against each other for our business. That brings choice and competition to the system. That gets rid of waste. That increases productivity and efficiency, and it's better for the beneficiary. We want to give people more choices, not less. Medicare already has a system of Medicare Advantage, prescription drugs, so we already have a rich tradition of having choices in Medicare, and we want to expand upon those choices.
Is there a possibility you're going to link this plan to the debt ceiling vote? In other words,
I can't answer that question. I don't know the answer to that. But the debt ceiling vote, we're not going to rubber stamp a debt ceiling. There's just no way we could do that. We want to get real spending cuts and real spending controls as part of the debt limit. What exactly those look like, we'll find out later on.
All right. Chairman Ryan, we appreciate the time. Thanks for joining us here on Bloomberg.